So right now it's your face on it.
Okay, so a very good evening, ladies and gentlemen. Thank you so much for joining us on this subsequent installment of Cancer and I. And we've had a good run, I suppose, over the past couple of months. We've had that whole intensive series of sessions over World Cancer Day, and we covered quite a lot of topics about cancer. But really, sometimes Big C, as we like to called cancer, is being overshadowed by, I don't know, now do we call it the bigger C or the little c, which is really COVID-19. And it's, of course, a double whammy when you think about COVID-19 and people living with cancer, or people who are, currently going through this whole process of getting diagnosed, getting treated with cancer. It's a difficult time. And I think COVID's compounding this, making this much more difficult. And one of the biggest concerns that many people seem to have, and this is really not only for sessions for people who are choosing to vaccinate. Okay, they're facing a lot of problems. Hey, should I be getting the vaccine? Is this vaccine safe for me? Is the vaccine going to cause me any problems? More and most importantly, people are concerned on whether this will affect their cancer treatment. Is this going to make my chemotherapy not work as well? Is this going to make my radiotherapy not work as well? My targeted therapy, these kind of questions are there and continue to be foremost in the minds of cancer survivors, patients, caregivers, family members. But also for the rest of us out there, common Malaysians, and now we're even getting a lot of us are being volunteers in your vaccination centers. We are hearing stories, reports of people being turned away because they're concerned on whether they can get vaccinated or not. And sometimes well-meaning volunteers are telling them, look, this is a matter of concern. Don't get vaccinated. And a lot of this very confusing news. So I think one of the best people that we can hear from is the expert. And I don't use this word lightly. Please allow me to introduce Dr. Martin Melo, consultant clinical oncologist at Subang Jaya Medical Center. As much as Subang Jaya Medical Center, our partner for this session of Cancer and I, is an institution, I think you have to also recognize that Dr. Martin is as much as an institution in this country as Subang Jaya Medical Center is. For many people, he is, as I say, I don't use this word very rightly, the oncologist. And I know he's giving all this uh, very concerned looks. And Dr. Martin has served our community in Malaysia for a long time. An entire kind of arsenal of experience, a wealth of knowledge, and he brings to us also the wisdom of his training and experience in dealing with cancer patients. So this evening, I am extremely excited and pleased and honored, of course, to be able to introduce our speaker for this evening, Dr. Martin Melo. Good evening, Doctor. Wow, wow.
Good evening.
Feeling
Good
cold,
evening, Molly.
sudah angkat a little bit tinggi already. No, it's always a pleasure to have you as well, Doctor. So we thought that it would be best coming from you on offering all our communities, our patients, our caregivers, on really addressing this issue pertaining to COVID-19 and cancer vaccine and cancer, and especially in this area of vaccination. Ambil atau tidak, take or not. That's actually the real kind of issue. And as we begin this evening, Doctor, could I ask you the magical question? How was your vaccination experience? What did you get? How bad was it?
Well, I had my vaccination a couple of months ago because being frontliners, we all got vaccinated early, and I got the vaccine Pfizer. So the side effects that I experienced, as with all my other colleagues, most common being the discomfort that you have in the shoulder, in the injection site. And when you when you read about the side effects that one experiences and compare it to what's written in the literature, it's very, very comparable. It's bearable, and It's nothing like TB vaccination. When you get TB vaccination, you get a big scar on your shoulder. This one you don't. Yeah.
Right. Okay. So those cosmetically inclined, don't worry about it. No scars as yet. So I got
Yes.
the Pfizer as well. Didn't do at all. There was nothing at all on the first dose. In fact, got me concerned on whether was I even being vaccinated properly or not. But don't worry, the second dose put me out for an entire day. Big buffalo like me, also out cold for a day. But but otherwise, nothing much to be concerned about. My 50 odd kilo wife took both shots and she was having the time of her life, so it's very individual dependent, nothing much to worry about in terms of side effects. This is, I suppose, two people's experience. But coming on to the topic today, doctor, why do you think, and I'm sure you all kind of know our kind of system at this point in time. Usually Dr. Martin will have some slides to kind of share with us over the evening as well, to kind of help put up the points in a visual manner. So feel free, doctor, whenever you have a slide that you want to throw on for us as well. So doctor, what do you think, why do you think people with cancer should even bother getting a COVID-19 vaccine? Is this even any, is there any why?
There is a
Yeah.
very big reason to do that. And if you allow me, Murli, I have some slides to show.
Lovely,
Um,
doctor. Please do.
very much just to get the ball rolling, so to speak. Very brief, 10 slides regards to COVID-19 vaccination as well and cancer. And if you allow me, I will share them now. It will probably take about 10 minutes of slides. And after that, we can have further discussion.
Lovely,
With your
doctor.
permission,
Please,
Dr.
doctor.
Molly? Okay, thank
Always,
you. I'm
doctor.
going to share my slides now. Um, okay, this is going to be very quick. Okay, thank you again, Dr. Muli, for the kind introduction. And you were very kind to say that I'm an institution. To a lot of people, that means that I'm old enough already to be like that, to be lumped into that group. So the question at hand now is COVID-19 vaccine and cancer survivors, is it safe? I mean, there are a lot of questions in people's mind, especially cancer survivors, with regard to the COVID-19 vaccine. But just let me share a little bit about give you an overview about the COVID-19 vaccine as well as cancer survivors. So a bit of trivia information, coronavirus disease 2019. That's why it's called COVID-19, because it was first reported in December 2019. It's actually caused by this virus called severe acute respiratory syndrome coronavirus 2, or SARS-CoV coronavirus 2. And on the screen there, you see the depiction of the virus with the spike protein, in which a lot of the vaccines are targeting. And on your right, you see the common side effects, common symptoms that patients who are afflicted by coronavirus infection. The symptoms include fever, loss of appetite, fatigue, loss of smell, and in severe instances, all those lists of symptoms on the right side, and this could even lead to death. Now, this is a very severe situation where this lungs is infiltrated by COVID-19 infection, and a, a lot of these side effects remain with the patient, even with the passage of the infection, leaving patients with some comorbidities beyond the recovery period. Now, COVID-19 is not the first, obviously not the first major virus breakouts, and I'm sure Dr. Murli knows this, being an epidemiologist. Over the last 50 years, there have been many virus outbreaks throughout the world. The one that's close to home are the ones like Nipah virus, the second bar, Nipah virus in 1998, the SARS outbreak. The difference between those and the COVID-19 outbreak is the fact that those outbreaks are rather localized in certain areas in the country. Doesn't affect the whole country. The difference is that with coronavirus, COVID-19, it is very, very widespread. It is a real pandemic. If you look at the mortality rate there, the mortality rate associated with the other virus outbreak is worse. With coronavirus, it's only 2.2% mortality rate in general, but it is much, much more easily transmittable, this particular type of virus. Now, if you look at the death toll associated with this pandemic, you see that the coronavirus, COVID-19, the number of deaths is 3.5 million worldwide, and obviously this number is ongoing. And if you look at the quantum, number of people who died from this is obviously smaller compared to the other sort of outbreak, just to give you an idea of how the severity of coronavirus in relation to the other pandemic. Now, this is a status in Malaysia as of today. We have got a total of about 705,000 cases, 4,554 deaths altogether, and a majority of the patients have recovered from coronavirus. So you can actually see the number of deaths. Of course, it's tragic still, but in terms of percentage, it's not as bad as the other forms of outbreak. The experience for the last 1 year also have also taught us there are certain individuals who are at high risk of developing complications from the virus. Cancer survivors is one of those. The others, diabetics, those with cerebral cardiovascular disease, those who are advanced age at presentation, those who smokes and have got pulmonary disease, hypertensive, kidney diseases, kidney failures, and on dialysis, people who are obese, people who have got weakened immune system like HIV infection. If they do get the virus, they tend to fare worse. With regards to cancer survivors, if cancer survivors were to get COVID-19 infection, they are at a high risk of complications if they are infected. And there's some estimation that there may be something like 7 to 10 times worse in terms of death associated with the infection. But obviously, the risk of the complication from COVID-19 infection is not the same for all cancer survivors, because cancer survivors are at various phases of their treatment and their trajectory. So it depends on the type of cancer that the individual had in the past, the stage of the cancer, depend on the treatments being administered, that they're currently on treatment or not, and the current status of the survivor. And it is not unexpected that in cancer survivors, the defense system may be a little bit weak for various reasons. They may have defective immune system. The immune system may be depressed as a consequence of treatment, and they may have multiple organ function defects because of the treatment, because of the illnesses as well. The highest risk of COVID-19 infection complications are reported in patients with blood cancers like leukemia, lymphomas, multiple myelomas, and because essentially this patient may not be able to mount an immune response at all. Those who have got cancer which has recurred and progressed also generally do less well. So with that kind of background, vaccination in cancer survivors, should they vaccinate against COVID-19? They certainly should. Are there any contraindications to the vaccination? Known sensitivity to COVID-19 or other vaccines. Now, there may be other illnesses that the patient may have had in the past, like allergic reaction to drugs, to food, but those are not a definitive contraindication. But if they had a COVID vaccine in the first round and they had allergic reaction to that, severe ones at that, that would be a contraindication to the vaccination. When would be a good time to vaccinate? Well, that generally depends on each individual patient status. Have they completed treatment? Are they on a follow-up surveillance program? Are they on maintenance treatment? Are they on chemotherapy, radiotherapy? When is surgery being planned? Are the imaging scans being planned for them? Because vaccination can affect the quality and what's being seen when doing the scans. For example, in PET CT scan, for example, one can see lymph nodes enlargement with a mammogram as well. It may pick up lymph node enlargement. The other very important question is which vaccine now? There's Pfizer, there's AstraZeneca, and there's Sinovac. And I think the general rule of thumb is you get whichever vaccine that's available to you. So coming back to the original question, COVID-19 vaccine and cancer survivors, is it safe? The answer to that is an overwhelming yes, but there are reported complications. And of course, there are common side effects like fever, body, muscle ache, um, and the injection sites, lethargy. These are among most common ones as well, other most common ones as well. And these side effects are usually more after the second injections. There had been reported rare side effects that end up with severe complications like myocarditis, inflammation of the heart, blood clots, allergic reaction as well. But those are not so common. With that, Dr. Molly, I'll end this talk and I'll be happy to answer any questions and we can continue our conversation. Thank you very much.
Lovely, Doctor. Thank you so much. So I just wanted to kind of go back over a little bit and kind of clarify for you because clarify with you because for a lot of people, there's still a lot of confusion, Doctor. So
Yes.
basically, there's this pocket of people, which is people who have been diagnosed with cancer, but
Mm-hmm.
they have not, so maybe they've got surgery but they haven't started chemotherapy or radiotherapy or targeted therapy. For this packet of people, okay,
Mm-hmm.
should what are your like kind of recommendations? Should they be getting the vaccine first, before they get chemotherapy or radiotherapy, or no, a lot of people or a lot of them are thinking that, look, I shouldn't get the vaccine first, it may interfere with my chemotherapy or radiotherapy. So what are your thoughts on that, Doctor?
I mean, I think the general recommendation with the vaccine is to get the vaccine.
Hmm.
With regards to the sequencing of the vaccine and the timing of the vaccine in relation to surgery or radiation or chemotherapy, obviously that's something that one needs to really have a good conversation with a treating oncologist. I mean, a general rule of thumb would be you try not to do the surgery within a short period of time of the vaccine because you may not, the complication from the vaccine may overshadow the complication from surgery, for example. Same thing with chemotherapy. Um, if, with regards to radiotherapy, radiotherapy doesn't affect the immune system. So during the radiotherapy, if one gets the vaccine, I think that should be fine. Again, one needs to be sure about the overlapping of the side effects. But on the whole, radiotherapy, depending on the sites, the side effects are relatively mild in general. The chemotherapy is a bit tricky because in general, chemotherapy does cause a bit of immune suppression, and the vaccination relies very much on you, individual mounting an immune response to the vaccination. Um, I think a lot of advisories, a lot of bodies like CDC, American Society of Clinical Oncology, they do advise that you actually do the vaccination because the complications that is attended for in patients infected with COVID-19 is probably worse um, in patients with cancer. So any protection is good. Any protection is better than no protection whatsoever, despite the expressed possibility that the immune response may not be as robust as in somebody who has got a normal immune system. So cannot be too specific about the recommendation, Murli, because it really depends on
Yep.
where the patient
Yep.
is in relation to
Yep.
that
Yep.
treatment journey. So my advice is to really have a discussion with your treating oncologist to have a definitive timing. Now, unfortunately,
Mhm.
the timing of a vaccine is not within your control, though, Murli. You know, so the experience that I've had is that the patient will come and tell me they are due for chemotherapy tomorrow, and they have just got my Shijato saying that the chemotherapy is their vaccination is due today, for
Right.
example. That creates a bit of a problem, so we'll have to schedule things. Personally, what I do is I would prioritize the vaccination. If they are supposed to go for vaccine, I would get them go and do the vaccine and then push the chemotherapy a little bit later, but not too much later. And of
Right.
course,
Right.
the chemotherapy again needs to be discussed because of what is the aim of the chemotherapy. If it's something curative, I would think I'll push for it a little bit harder in that
Okay.
sense.
Well do. Got it, doctor. I think that is sage advice, because I was just going to ask you, because now we're seeing a trend where, with people, especially those on active treatment, I
Yeah.
think there are some suggestions or even recommendations where, like, look, go back to your treating oncologist so that like, for in your center, for example, are you giving the vaccine for patients within your own setting? So, like, if a cancer patient within your care, they come back to you, would you then organize it to be given there?
Oh, we can't. We can't.
Ah,
I mean, HMC is a vaccine center,
right.
but the people who come for vaccination are directed by my
My
Sejatra.
Sejatra.
Yeah, so we cannot recommend any
Yeah.
patient for vaccination in our center. Although there are some of our patients who are actually on standby because there are some drop out from the vaccination. Some patients don't turn up, or some individuals don't turn up for the vaccination. And we certainly don't want to waste those vaccines.
Yep.
And some patients are actually on standby.
Yep.
Those who are nearby who can be called at the drop of a hat, who can turn up at the drop of a hat.
Right. We are also getting, doctor, it is an interesting opposite type of patient compared to
Mm-hmm.
that I was telling you earlier. So these are
Mm-hmm.
people who have been diagnosed with cancer, scheduled for surgery, but they're
Mm-hmm.
saying, like, look, I don't want to get surgery. Let me get vaccinated first. And, after I get vaccinated, I'll go have my surgery to remove my tumor. So what do you
Mm-hmm.
think, doctor? Should this be a way to do things?
Mm.
Thoughts on this?
Okay. I think that it depends on what kind of surgery it is. It depends on what kind of cancer it is as well.
Mhm.
If the vaccination, now, it also depends on the type of vaccination. For example, the AstraZeneca vaccination. AstraZeneca vaccination, as it currently stands, the first and the second one, there's a 3 month gap. And I suppose you can have the injection, you can have vaccination, the first vaccination, then go for your surgery. And then when the next one is due, then you have to review that position again. I understand that there are some moves to trying to bring it forward to 2 months, but really at this point in time, that's not quite clear. Now, with regards to surgery and vaccination, you want to try to keep a gap between the two. Again, um, because the vaccination can cause some complications. Surgery also can cause some complications. So if you give a gap, the recommended, at least in some advisory, to give a gap of 1 to 2 weeks between the vaccination and the surgery. Yeah, so that's as close an advice as one can give.
Right.
Um, but personally, I think if the patient needs surgery, I think they should go for surgery as soon as possible.
Yep.
Vaccination can push it back a little bit.
Yep. Absolutely,
Yeah.
doctor. Because one of the reasons why people seem to be scared is they're worried that they'll get COVID in the hospitals.
All
Any,
right.
yeah, yeah, yeah.
All right.
So,
Yeah.
and doctor, as a clinician working in a really, really busy hospital, uh, I mean, of course, this may be kind of closed data, but any kind of broad picture, is there really this kind of COVID transmissions happening between patients and hospitals? Like going for surgery, end up
Yes.
with COVID.
Well, with surgery, yes. Well, what is being done in Subang is that every patient that comes in for any sort of procedure, they do have a COVID test done.
Right.
But there had been instances where, at least in the earlier times, patients going for surgery, and they turns out to be COVID positive. There was an incident where a patient developed cardiorespiratory arrest in the hospital, and they had to be resuscitated. And that patient turned out to be COVID positive, and those people who are resuscitating were exposed
Oh dear.
to the virus. Yeah. And personally, I've had patients who are COVID positive that come in with an unrelated complaints. They come in because of fever, and because post chemotherapy they can get febrile neutropenic, and when they do come in, we always manage the febrile neutropenia. But nowadays, this COVID test is done as well, and there'll
Right.
be a couple of patients who turns out to be positive. They've got febrile neutropenic, and they also concomitant infection with
COVID.
COVID-19. Yeah.
Oh dear. Uh,
So they are in intra hospital transmission of COVID. Yes.
Okay, but next question on kind of a similar pattern would be this other segment of people, doctor, patients who have
Mm,
completed treatment. they're not on active
Hmm.
treatment anymore. Maybe there's some kind of maintenance therapy on, like
Hmm. Yeah.
tamoxifen or something like that. So
Right.
for this set of people, is there something to be concerned about? Quite a lot of kind of queries from people on, oh, I'm on this maintenance therapy. It's going to affect me taking the vaccine. Any kind of thoughts on that, Doctor? Insights?
Well, absolutely. I mean, there have been, I mean, personally, I've been asked this question many, many times as well. And being a treating oncologist, I signed that MOH letter for vaccination a lot, Yeah, so in one of my slides, I did say that patients who are on maintenance therapy or just on follow-up without any treatment, uh, there is no reason why they should not get the vaccine. With regards to hormonal therapy, hormonal therapy generally does not affect your immune system in a big way. But having said that, there aren't any big enough trials to actually say that that's safe. There have been a small study looking at patients who are on immunotherapy
Hmm.
and with the vaccination, and that no contraindication to the vaccination. So patients who had completed the active anti-cancer treatment, who are on just surveillance follow-up, or even who are on maintenance therapy, for example, there's really no contraindication to the vaccination. So they
Okay.
should go ahead.
Lovely. Okay. And now, doctor, this is, I think, a system issue that I need to speak to
Mhm.
you about. System issue in the sense that some of our colleagues, patients are being naughty as well. And, and there's some instances where I think the health system, we need to kind of do some correction to it as well. So what do I mean by this is exactly what you were saying earlier, which is this pre-vaccination assessment. So the government has kind
Mhm.
of said that if you're in active therapy, if you're a cancer patient, you have any other kind of chronic disease, look, go and get a pre-vaccine assessment. So for some people, they're little bit lazy. So what they do is they switch off. They don't tick that they have any comorbidities in their My Sejahtera, just to kind of
Mm.
get over that. Now, a question,
Right.
doctor, it's like,
Yep.
oh, is this advisable? Hey, I don't have the hassle of going to see my doctor again, looking for Dr. Martin and going to see him and getting this pre-vaccine assessment. I know I'm fine, so I just switch it off. Lah. What your thoughts, doctor?
I think it would be best to be absolutely transparent with them, because that may, put you in a position where they would might observe you, or for a longer period of time post
Right,
vaccination,
right.
and also try to triage you in profiling your probable risk post vaccination.
Mhm.
Okay, I suppose there are two questions as well here, because if you are a cancer survivor when you have your vaccine, is the vaccine, two questions. Number one is the vaccine going to be effective or not?
Mhm.
Number two, are you going to have a bigger, more complication associated with the vaccination?
Right.
So we've talked about the efficacy of the vaccine early on in with cancer survivors, but the complications of the vaccination in cancer survivors doesn't appear to be any more than in the general population.
Population.
Yeah. So yeah. So my advice to those who they got no comorbidity, it's like shooting themselves in the foot, because they would put themselves in a group that's going to be pushed back for the vaccination.
Absolutely, that too as well. And then
Yeah,
you
that's true.
complain, yeah. So then you're complaining that, hey, nobody's calling me, but I think
Yeah,
you
you are
basically shot
healthy.
yourself in the foot. Yeah, exactly, exactly. And
Yeah.
also, I think as Dr. Martin was saying earlier, ladies and gentlemen, there's so many variations in cancer. Sometimes we tend to think that cancer is just one single disease, like
Mm.
COVID-19. It's not. In fact, I mean, I hate to use this term, but actually the word cancer, I think within it, there's a whole diaspora of maybe thousands of possible permutations and combinations and, treatment regimens which differ from every single person. So,
Mm.
and this is where kind of the system is a little bit worried as well, because this is exactly the complaint that I was telling you and telling Dr. Martin of what a lot of cancer survivors are facing. Look, you marked cancer, and you're getting your My Sejahtera, you're getting called up for appointments. But the moment these chaps and a lot of our junior guys are the ones manning your vaccine centers, your stations.
Mm.
Some of them are volunteers, and not all of them are trained medical professionals who are looking very intricately into the guidelines. So the moment they see cancer, these fellows are getting a little concerned. So, and of course, with that little concern, they turn to you and ask you, hey, where's your pre-vaccine assessment? Because now they're looking for a
Yes.
senior physician who has done that, and then you do not have a pre-vaccine assessment. And a lot of people are getting sent home for that. So
Um,
could you put in some stern words, doctor, kind of advise our chaps? Yeah.
yeah. That's very, very true. I mean, we have been inundated with calls sometimes from very irate individual because we don't respond to their call immediately
Yeah.
because they signed up with My Sejahtera and they went up to the vaccine center, and when they go to the pre-vaccination assessment with the individuals there, and they say, "Oh, you got cancer. Where's the letter from your doctor?" I say, "No letter." "Okay, no letter, no vaccination until I get one." So they get out of the room, frantically call us to send them this letter. Uh, and when it comes to me, I have to, I have to look back into the records and see where actually they are in terms of their treatment and post status before I give them the letter and fax it to them.
Yeah.
But you're quite right. There have been a number of individuals who had been turned away because of the diagnosis of cancer, even when they are on maintenance
Yeah.
follow-up and they are not no treatment.
Yeah.
So the advice is to go back to your oncologist. It's very easy to get that letter.
Mhm.
It's an MOH letter. It's all pre-printed and all that.
Right.
And you get that letter, then you are in the clear. You
A-
know.
Absolutely, doctor. And
Mm.
ladies and gentlemen, look, that is a big take home from today. And what I'll do is one of our colleagues, we have that on our website as well as on our social media. If you're watching this, you're probably on Facebook anyway. So go hunt for it. It's pinned somewhere, but I'll also get my colleague to put it up right at the end of this session where that link is. So if you have not got it, please download it. There's a Word document that we'll leave it right at the end of this session on Facebook. The link will be there. So please download it. And as Dr. Martin says, look, the guy who's assessing you, sometimes literally all these, especially these big vaccination centers, they're doing 5,000, 8,000, 20,000 a day. The first got not that much of time to sit down and get a detailed history. So
Mm-hmm.
he's just going to
That's right.
look and see, do you have a pre-vaccine assessment? And then he sees your My Sejahtera, you don't have cancer. Okay, bye. Go and get one and come back. So then you have to go through all that hassle all over again. So kind of better to be pre-warned, even though maybe you're only on maintenance therapy. I think it might be at this point in time prudent to go ahead and get that letter from your oncologist, or even actually if you're on maintenance therapy, I think many of your GPs would be able to provide that, right, doctor?
Yeah. I'm not sure about GPs though.
Oh, okay.
I'm not sure about GPs to
Okay.
be honest with
Yep. Yep. Absolutely. So, yep. If you're on maintenance, or even if you're on long-term follow-up, you're going to see your oncologist maybe yearly. If you're getting call from My Sejahtera, look, I think it's better if you're signed up for My Sejahtera. Look, go and have that consultation. Say hi, buy Dr. Martin a coffee, or whoever it is, your oncologist, coffee or soya bean or whatever, and I think it's worth to get that. Okay. Lovely. Now, Doctor, just before we go into questions, and this seems to be a very, very intense session in terms of questions. There's something like 20
you.
questions already. Uh, yeah, it's giving me a little kind of flutter, but I just had to ask you this as
Mhm.
well, and this is kind of a big kind of issue which a lot of patients are grappling with. Now, a lot of people are concerned, and we talked about that right at the beginning, on whether by taking these vaccines, will they cause my cancer to get reactivated, come back, or get worse?
Definitely not. I mean, there's really no study to confirm that, and and it's just that knowing in a mechanistic way how this vaccination works, it really cannot reactivate your cancer. It doesn't make your cancer any worse. It doesn't make your cancer any better, really.
Right, right, absolutely, doctor. Thank you, because those are words we really need to hear. Also,
Mm.
doctor, now and now I'm playing the whole what is this anti-vaxxer hat on here. Now,
Hmm.
if that is so, then why is it during chemotherapy you don't want to let us take vaccines? That means the cancer, the vaccine will interfere with the chemotherapy, right? Or it'll interfere with the other treatments, right?
Well, as I did briefly talked about in a mechanistic way how this is supposed to work. When you get the vaccine contains the protein products of the virus. In COVID-19 is the spike protein um, antibody that's generated. So whilst you're having chemotherapy, the reason that you don't respond well is because your white cell count might be suppressed. The white cell count is like the important cells in the body that's going to initiate the formation of the antibody in the body. So if your numbers are low, you may not respond in a robust way, so that your percentage of antibody would be lowish, and therefore it might not provide you with the protection that you actually need. But as I said earlier in the beginning, also some protection is better than no protection.
Mm-hmm.
Of course, the other question that people always ask is, if in a situation where your chemotherapy is a finite number, for example, 2 or 3 months, for example, as with typical with this the adjuvant chemotherapy. The chemotherapy is typically 4.5 months to 6 months, for example. So you can have a discussion with your oncologist as to whether you want to defer your vaccination until you finish the chemotherapy. But a word of caution is that even on the completion of chemotherapy, your immune system might not be normal for many months after the complication of chemotherapy, that your immune system can work at its level best. So if you want to look at the advisory from the big oncology societies, they recommend that you actually get your vaccination. So this brings up another question that I have been asked. So if I get vaccination whilst I'm on chemotherapy, and you can't tell how protected I am, then I have further vaccination, the so-called, the booster at a later time, maybe after 2 or Pfizer, maybe another booster at a later time. So I've always tell my patients that at this point in time, you don't have the information. The story of the booster is still not clear, but it may well be so later on.
Yep. Yep.
Now, this brings another question as to how protected you are with the vaccination.
Yep.
Does the presence of antibody means you are protected already or not? And what is your level of protection? A lot of unknowns in this scenario.
Yeah, and interestingly, and I'm sure Dr. Martin is one of the hospitals that are rolling this out. I think IMAR has now just put in a new test kit to look at antibody levels in post-vaccinated patients. So that might be making its way to all our hospitals, and most importantly, that will then be another kind of weapon in our arsenal. But so far, as Dr. Martin was saying, the big clinical trials and the post trials are important, because what they're showing us is even in the cancer-specific population, doesn't look like there's really immunocompromisation. There's still like a healthy generation of antibodies post-COVID vaccination. Isn't that so, Doctor? So, yeah, we don't know how long it will last, though. Nobody knows. But once those numbers come out, I'm sure we'll be very happy to share them with you. And if then, yeah. Okay, Doctor, let's come to the dreaded part, start taking the questions. Okay. Okay, first question, Doctor. For cancer survivors, is there any particular vaccine, or are all vaccines good for all cancer survivors? Oh, wow. This was a killer, right? The first go.
That's a loaded question, because it depends on what you read. If you read the Western literature, with the vaccines that they've got vector vaccine, they've got mRNA vaccine. There's no risk, but they have expressed that patients who receive the attenuated vaccines, that means it's a virus, but it's attenuated or heat denatured so that they are less virulent, and the Western population said it may infect somebody's immune compromised. That relates to the Sinovac vaccine, because Sinovac is the attenuated vaccine, the dead vaccine, sorry. So that's one of the points. But as it stands now, most advisory is that you get the vaccine, whichever vaccine that you can get your hands on. Pfizer is no better than AstraZeneca or Sinovac. So those are the three vaccines that we have right now. We don't have Moderna yet. So whichever vaccine you can get, you probably
Use
should get
at
them.
this point in time.
Yeah, at
Absolutely,
this point
doctor.
in time.
Absolutely. Lovely, doctor. Thank you, doctor. And oh, yeah, yeah. No, let me make this clarification right now itself. Yeah.
Mm.
So this session is sponsored by Roche. I mean, they've supported the session since the beginning of the year. So it's Roche shared services, both their pharma arm, diagnostics arm, and I think shared services. But very important to know that both Dr. Martin and me, so Roche doesn't have any COVID-19 vaccines, so we're not promoting any particular
Great.
brand. That's critical, and none of us are paid by Roche. So just to kind of make that clear.
Okay.
So then suddenly, oh, we are supporting Roche with your COVID-19 vaccine. No COVID-19 vaccine from Roche. Okay. Second question, doctor. So how long after the last chemo can we take vaccines?
Okay. Yeah, that's an important question, that one. So generally speaking, you want to maybe have the vaccine after a period where the side effects of the chemotherapy has subsided. Generally speaking, 2 or 3 weeks later. But you see, if with the chemotherapy, the period of time when your white cell count is probably at its lowest, the nadir of the white cell count is usually about 2 weeks or so. So getting the vaccination 2 weeks post chemo might not be the best thing to do, because that's the time when your white cell count is at its lowest, and probably won't be able to generate as much immune stimulation compared to if you do it a bit later.
Right.
So presumably post chemotherapy, if you really don't want to delay it, maybe about three weeks and beyond.
Okay, will do. Got it, doctor. What is this? Okay, next question is, my mother just started the chemotherapy in July. I think it's June, because we
June,
haven't
yeah.
reached July. Yeah,
June, July, yes.
yeah. Because it says 2nd of July. I'm like, oh, okay, a bit too quick. She will complete her chemo and radiotherapy by December 2021. This is exactly, I think, what Dr. Martin was talking about just now. Is it safe to wait for the vaccine, for her vaccination, till these therapies are completed?
Okay, so in this situation, one needs to know what kind of chemotherapy she's receiving for what kind of cancer,
Mhm.
because the immune suppression induced by the chemotherapy can be a little bit varied. Some of it are less immune suppressive compared to the others. So again, it's an opt-out question, is to have a discussion with your oncologist
Mhm.
as to what worked best for your mom. But operationally, because comes December, I think that's a bit too far out. I think you should consider the vaccine sooner rather than later,
Right.
and work around the chemotherapy.
Right. And doctor, this is another kind of system question, which we've had a couple of patients like this, because especially those being treated in public centers, one of the
Mm-hmm.
concerns is, you see oncologists in one place, they now
Mm-hmm.
give you therapy in a chemotherapy in a totally different place.
Mm-hmm.
Sometimes you come to see the oncologist in KL, then you get chemotherapy in some other state where
Oh,
you're
right,
from. And sometimes the concern is the patient is lost in translation. Like,
right, right.
everybody's thinking that place giving the vaccine, this place giving the vaccine. So
Yeah.
what should be like, if your advice to patients, like what's a safe period, or within, like, do you think when they see the oncologist, they remember, and just kind of remind them, hey, look, I haven't got any discussion about the vaccine, can I have that
Mm-hmm.
discussion with you?
Yeah, yeah, absolutely. I think should have a discussion with the oncologist with regards to the timing of the vaccine. As I stressed, it really is important the kind of chemotherapy that patient is supposed to receive, and the degree of immune suppression that's going to be induced by that. But I'm more pro to give the vaccine early as opposed to giving it later.
Yeah. So this is really to our colleagues who are, sometimes being treated in different centers, especially in the public
Mm-hmm.
sector. You may
Yeah.
move centers, but really remind yourself, because sometimes really the oncologists, as with the rest of us, everybody is just dead tired since March 2020. All of us wish we could just close the door and pretend that the world doesn't exist for not like 2 months or so, but we can't. So as much as everyone is overworked and really stressed, sometimes they kind of slip. And I
Yes.
think the operative word is sometimes, and not intentionally, they may kind of forget to have that conversation. So always remind them, and have that conversation with your oncologist. Even if you're crossing between like chemotherapy in one place, radiotherapy in another, have that
Mhm.
discussion. I think that's an important point that Dr. Martin is mentioning as well. Doctor, next question was on, my mother went for her first chemo last month, and now is getting vaccination. Any symptoms and side effects to expect, I think, from the vaccination? I think they
Yeah,
slated her for vaccination. Yeah.
yeah. I mean, the vaccination, you could, there's a lot of literature and the kind of side effects that you can expect. The common ones at the site of injection can be painful. They can have body ache, muscle ache. They can even have fever, lethargy for a day or two, generally speaking, but usually not more than that. Usually the side effects is worse after the second injection. Um, I had one colleague, in fact, who described the side effects as being like severe dengue. They get really muscle ache and they're very tired for a couple of days, but they generally would recover from that anyway. Yeah. So the important thing is to remember those are the kind of side effects that may be induced by the vaccine, but some of the side effects from the vaccination may overlap with the side effects of chemotherapy. So the fever, for example, chemotherapy, febrile neutropenia, for example, can present with fever, and you really don't want to miss that. People who have febrile neutropenia needs to be treated as an emergency. And when you have the vaccination and chemotherapy at the same time, be very low threshold to investigate people with fever, just to make sure they're not febrile neutropenic and pass it off.
Right. Got it,
Yeah.
doctor. Doctor, another question is, other than arms, can we
Mhm.
vaccinate other parts? That's an interesting question.
Yes, interesting question. Um, I suppose you can. I mean, you can do it on your buttock. You can do it in
Yeah.
your the abdomen.
Yeah.
I know of a colleague who, instead of showing their deltoids, they show their buttocks and jab in this buttock.
Right.
But there's no rhyme or reason why you can't.
Yeah. Yep. However, ladies and gentlemen, keep in mind, public PPV, showing your buttock might get you arrested. I've got no more comments on that.
Well, just the upper part of the buttock, not the whole buttock.
Whole buttock, like, yeah, yeah. Oh, dear. I think the act itself, people just get really worried. Next question, doctor. Oh, this one is
Mm,
quite a challenging one. Since
mm,
COVID vaccines generally have not completed clinical trials on cancer patients
mhm,
specifically, there are concerns raised that these vaccines may cause genetic mutation and hence tumor growth or progression. What are your thoughts on
mm.
this? Wow, wow, wow.
Okay. So this question was addressed specifically.
Mhm,
There are a lot of communications about that. For example, if you look at the ESCO website, does this vaccination cause mutation, especially the mRNA,
mhm,
whether the mRNA can be incorporated into your genetic material in your cells and induce cancer at a later time. At this point in time, there's actually zero proof of that.
mhm.
Now, whether that's going to be the case in the future, I suppose we'll have to wait and see. But in understanding the way it works, it's just not feasible that it will do that.
Yep. Yep. I think more so than mRNA, a lot of people get this mRNA thing mixed up. They think it's the
Yeah.
mRNA that's going to cause the mutation. When actually the mRNA, once the first round it's been delivered, then mRNA is destroyed. Right,
Yes.
doctor? But I think the
Yep.
concern, which I think we have to be kind of transparent about, is viral vector vaccines.
Yeah.
And whether because the vectors themselves are viral in nature,
Yep.
but we don't see any data of that, right, coming out.
No. No. I mean, viral vector vaccine have been around for a long time,
Yeah.
and we don't see any evidence of cancer, higher incidence of cancer in those who receive the vector vaccine.
Yep. Yep. Absolutely, doctor. Next question. Oh, this is quite up there. We've got a very changi audience, doctor. I have to tell you.
Oh,
So
very
this
good.
one is, which is lovely. It's always quite interesting to share these updates. And
Yeah.
now, since we've got Dr. Martin, who's able to field all this like sayo, as they will say, sayo. There's some combination. Okay, there are questions on using combinations such as the AstraZeneca, Pfizer, and this has been suggested. Any data that this combination works in a cancer population, doctor?
There isn't any.
Okay.
I think full stop. I mean,
Mm.
we can speculate
Yeah.
the way it works and all that because I think. I'm not sure what is the motivation of combining them together. Probably because one, they work in slightly different ways, and you stimulate the immune system in two different ways that you might get a better response. But really, there's no data available.
Yeah, yeah.
Full stop.
I think
Yeah,
that's absolutely the state of this point in time. For our colleague who's asking this question, the good news is, I mean, and this is probably where countries like Europe and the US and UK are slightly better off than us because they've got a lot of real time data collection points.
yeah,
Like the US is very able to give you like something like 50 million people's data,
yeah,
and I'm sure within that there's that cancer population. So if they're going to try this, they'll definitely have the data. And our country being how to say quite careful at these things, we've not really used any of these therapies without the like adequate data lah, to kind of back it up, isn't it, doctor? We're not
yeah.
just
That's
jumping
right.
blind into these things lah.
Yeah.
Okay. Next question, doctor. I'm still consuming tamoxifen. Okay, so is it
Yeah.
okay to get vaccination? My friend went to get the vaccine, but she was asked to go back by the nurse. I think this is exactly what we're talking about. Is it true that taking tamoxifen cannot get vaccine?
No, absolutely not true. I mean, tamoxifen has got lots of potential side effects, but in practice, it's a very, very well tolerated drug. Um, some people do complain that the white cell count do drop. We see that very, very uncommonly. White cell count can be not, it's suppressed somewhat,
Okay.
but there's really no reason why they can't get the vaccination.
Right. Right, absolutely. So, to my friend on tamoxifen, really, this is exactly what I'm telling you. You really need to get your pre-vaccination assessment. If not,
Yes.
this case is going to keep on going on and on. It's quite unfair
Yeah.
to expect, like a nurse to see a cancer kind of mark in the My Sejahtera and be not concerned about what you're on and all that as well.
Yes,
Exactly.
absolutely.
Doctor, next question. I am a cancer survivor since April 2008 and have experienced severe allergies to shellfish, crab, until I was admitted in the hospital in September 2013. Should
Mhm.
I vaccinate, or what is this? Or what should I need to be cautious of? Is Sinovac suitable for me? Naughty. There's three questions all at the same time.
Okay. Okay. And obviously, there are many people who are allergic to different things, but it's not an absolute contraindication. If one is concerned about the kind of allergies that one have, probably the best thing you can do is to get vaccinated in a hospital setting, I would think. Those big vaccination centers, although they have got all the resource facilities available, but because of the sheer numbers may not be as conducive to you who has got allergies. So my advice is go ahead with the vaccination, but try to get it in a hospital setting where it's a smaller group and access to you is, should you have an allergic reaction, is very fast. But having said that, if you look at the documents, the MOH documents of the vaccination is a very comprehensive document looking at what needs to be available, even in the big vaccination centers. And one of the things that they are really concerned about is the risk of an allergic reaction. So I think they are well prepared for that if it does happen.
Right. Right.
So an added layer of protection would be to maybe do it in a hospital
Hospital.
setting rather than,
Yeah,
yeah.
absolutely. And just to this colleague, if you're listening, there is an option, My Sejahtera. If you mark up serious allergies, exactly what Dr. Martin is saying, the system will direct you to a tertiary hospital to be vaccinated in that setting, lah. So that's what the My Sejahtera people have told us. And
Oh,
I
that's
mean,
good to know, Murli.
yeah, yeah.
That's good to know. I didn't
Yeah.
know that.
Okay. So they apparently do that's one of the kind of main flags, lah, doctor. So you mark that on your
Mm.
My Sejahtera, they will direct you to be vaccinated in a hospital straight
Mm.
away.
Okay, that's
Um,
good.
okay. So next one, doctor, and I think this one we covered. How soon can a patient after their last chemotherapy take up the vaccine? So I'm not going to ask that to you.
Mm-hmm.
My mom has to do radiotherapy after chemotherapy. How
Yep.
soon after radiotherapy can she take the first vaccine? Actually, what you were saying, she doesn't need to
Yeah.
wait, right?
Yeah. In fact, if she's on radiotherapy, but it depends on the area of radiation as well. And it's very rare that we irradiate the deltoid, where the vaccination site is. But say assume that, the most common cancers that people receive radiotherapy for after chemotherapy is breast cancer. So in that group of people, in the radiation to the chest wall and to the neck, the injection can induce swelling of the lymph nodes under the arm. So for them, I would think that vaccination is possible to do it at the same time of the radiation, but possibly do it on the contralateral arm, you know. So if you're radiating on the left chest, vaccinate on the right side
Right
and vice
side.
versa.
Right.
Yeah.
And just
Mm,
in case you guys didn't know that when you go for your vaccination, you even though the chairs are sometimes positioned in a different way, you can tell your nurse or your vaccinator, whoever it is, which arms you want to get vaccinated on. Yeah. That's absolutely you're right. There's no issue with that. So they'll just make you
mm,
sit another way or something, because again we've had complaints like of people, especially with breast cancer, and
mm,
then for example they have lymphedema, but they're so
mm.
concerned to tell their
Right.
vaccinators, or yeah, don't vaccinate me on this arm. Don't worry about it. It's absolutely you're right. Go ahead and tell me.
Yeah.
And then they're worried because they say, oh, the chair is put that certain way, you know. So yeah, but don't be worried about it at all, isn't it, doctor?
Okay. Yeah, that's absolutely right. I think that's important point as well to make, to make sure that lymphedema arm, you shouldn't inject in the lymphedematous arm. Should inject on the contralateral side.
Yep. Yep. Okay. This one is so this patient says I'm on immunotherapy, a certain brand, Keytruda actually, and now my
Okay.
oncologist is I have not got direction on whether to take the vaccine or not. One of my friends from another hospital is on similar therapy, or she didn't, yeah, and not sure whether her oncologist said can take. So basically, question I think is on immunotherapy. Should we? Is it
Can you take?
possible? Yeah.
Yeah. My answer to that is yes. You can take vaccination.
Right, absolutely. So have that conversation and get on it. Absolutely. Okay. This one is just to check for my friend who has had breast cancer. Oh wow, this is quite
Everybody's
worrying.
checking on their friends, huh?
Yeah,
Asking for their friends.
finished all the treatment but turned positive for COVID.
Mm.
Now, how long is the duration that she has to wait after she has recovered to be safe for vaccination?
So this is a question of vaccination post COVID.
COVID.
Is that right?
Yes, looks like it, doctor. I
Yeah.
don't think the breast cancer is.
Yeah.
Yeah.
So once all the symptoms have settled down, you can get the vaccination.
Okay,
The
lovely.
symptoms of the COVID, that is.
Okay, lovely, doctor. Should I now take up the vaccine because I'm still continuing on radioiodine treatment?
Radioiodine, again, not a contraindication. Radioiodine, depending whether if the radioiodine just for thyroid cancer is very high dose, if it's for thyrotoxicosis, lower dose. The high dose of radioiodine can cause some degree of immune suppression because it suppresses the bone marrow. Um, Going back to the first principle, though, the timing when the radioiodine was given, what the counts is like. Again, vaccination should be something that one should be considering very, very strongly. But again, have a conversation with the nuclear physician, looking at the timing of the radioiodine and so on and so forth. If it's just thyroid for thyrotoxicosis, I think that's not an issue at all.
Okay, got it, doctor. I think you covered this already, doctor. Which type of, is there any kind of different any kind of preferable vaccine for a certain particular type of cancer? So,
No, there
yeah,
isn't.
yeah.
There isn't any.
Okay. Oh, this is lovely. This is a listener, a viewer who's just like on point. So since we talked about choosing the arm to vaccinate, she's actually got a very real concern. What if you have breast cancer on both sides? Which side should we then think of giving the injection at?
Okay, so let's come back to the question that somebody asked earlier on, can you vaccinate in a different size or not? You know, um, okay, so seriously, the question of double breast cancer on both sides, again, depends on the kind of surgery that had been done to both breast sides. If she had axillary dissection on both sides, maybe this is a situation, maybe one should actually choose the buttock
As an
uh,
alternative, lah.
yeah,
Exactly.
as a preferred choice of injection.
Yeah. Lovely.
So there are no shortage of way to inject in the body, and they work just equally well,
Right.
irrespective of where you inject them.
Right. Absolutely. Thank you, Doctor.
Mm.
And I think we can take another one or two more questions, Doctor. There's one on,
Sure.
I'm currently on anastrozole and zoledronic acid injections. Anything to be concerned about? I think we're talking, Dr.
No.
Martin was telling you about
Yeah.
hormonotherapy and
Yeah. Zoledronic acid is the bisphosphonates for bone meds. Again, no contraindication to
yeah.
the vaccination with that.
Yeah, lovely. Thank you, doctor. And this is, oh, and so I was hoping we wouldn't get this one, but we have this one. I am 3 years post BMT, classical Hodgkin's. I've had my
Mm.
AstraZeneca jab. What are your thoughts on ivermectin for prophylactic therapy? I was telling, yeah. Yes, doctor.
Okay. So ivermectin, I know
Yeah,
the alternative practitioners are pushing it for its use, and they claim that there are a lot of clinical studies that attest to its efficacy. But practicing in an institution where we are governed by guidelines and evidence, the MOH, is not a licensed treatment anyway.
yeah.
So and the CDC doesn't recognize ivermectin as a form of treatment for COVID.
Hmm.
So the official line would be, no, we don't recommend that.
Right, right. Absolutely.
Ivermectin, that is.
Okay, and I think we're all quite open about it, right? Until we get
Yeah.
enough data,
Yes.
which look, nobody pushed for the COVID-19 vaccine until the data came out. When if no means we would have just started getting people to take cholera jabs
Mm,
and hope that they worked for COVID,
that's right.
you know,
Hydroxychloroquine,
yeah,
yes, that's
yeah,
right.
yeah, and yeah, absolutely, Doctor. Hydroxychloroquine went the same way as well. So there's a success story, and there's a not so successful story. So the not so successful story was hydroxychloroquine. You went at hydroxychloroquine. Everybody thought it was the best thing since toasted bread, but it failed every single clinical trial. Didn't do as well,
Mm,
and so we didn't use it. But dexamethasone
hmm.
worked, and it went the clinical trial route for COVID. They used it. It's a cheap drug. I think in some cases it's cheaper than pisang goreng, and it was proven to be effective. We use it, and I suppose isn't that what's going to happen to ivermectin until we see data, and the data is
Correct.
good.
Correct. That's right. We have to look at data. I mean, with regards to steroids is an anti-inflammatory agent. So with a lot of inflammation in the lungs induced by COVID-19, it doesn't, it doesn't, it's not rocket science that steroid would work to reduce
Yeah.
that. But dexamethasone by itself is not an antivirus. I think we have to be very clear about that. So
Yeah.
the dexamethasone must go hand in hand with other
With
forms of
other.
antiviral treatment for it to be successful.
Absolutely, absolutely, doctor. Yep. And so as we come up to the hour, which is really good. Thank you, doctor. I think we really kept quick on this one. Could I kind of ask you for some parting words of wisdom for us as we wrap up the session tonight, doctor?
Thank you very much, Dr. Murli. So with regards to the vaccination, COVID-19 vaccination in patients with cancer, it's a no-brainer. Go for it.
Okay.
Thank you.
Thank you, Doctor. Wow, wow. That was the one shot, lah. That was the parting one sentence. So, ladies and gentlemen, thank you very much for joining us this evening. We'd also really like to thank our guest this evening, Dr. Martin Melo, consultant clinical oncologist at Subang Jaya Medical Center. And also we'd like to thank, of course, Subang Jaya Medical Center, our partner for this session of Cancer and I, and Roche, our sponsors across the entire series of Cancer and I. What I'll also like to end this session with, and as Dr. Martin and myself take ourselves off air, is two things. One, we did tell you that we'd put up the word link for the pre-vaccination assessment. So if you can't find the form anywhere, look, it's going to be on the screen in a couple of minutes. The link is there. Screenshot it on your phone or on your PC, and then subsequently, what is this? You can download it and give it to your doctor if you need to get that assessment done. So if you're doubtful, just get it. Okay. And the second thing is, and this is really for caregivers and for patients who are not so well, for chronically ill patients who are at home, who are bedbound and unable to kind of ambulate, get themselves to a vaccine center. Look, the government is working together with National Cancer Society Malaysia and a lot of other NGOs. We are going on a home-to-home vaccination program all throughout the country. Now, we've put up a link, and that link will be right on after this as well. So if you have, or you know of a patient, or you are a patient who's bedbound or chronically ill at home, you think you need vaccination to be given to you at home, don't laugh because you malas want to pay for Grab. Doesn't work that way, lah. But for those who are genuinely ill at home, by all means, please put up your names, and then we will arrange for vaccination to be done at your home. So we will come in and do it for you. So with that, ladies and gentlemen, I hope we've been kind of helpful in helping you decide or for the better, especially for cancer patients on COVID-19 vaccination. Again, thank you so much, Dr. Martin. Always a pleasure to have you with us.
Thank you very much, Murli.
And,
Thank
and
you
have
very
a good
much.
night, ladies and gentlemen. We'll see you at next month, Cancer and I. Thank you and good night.
Good
So
night.
just don't run away. Me and Dr. Martin will leave, and then we'll put up those slides with all those forms that you can subsequently get at, download, and use. Thank you.
Okay. Thanks, Murli.
Thank you, Doctor. Good night.
Thank you. Bye.